Tuberculosis. Commonly abbreviated as TB, tuberculosis is a respiratory infection mainly found in the lungs. However, it can also be spread through the lymph nodes and bloodstream to any organ in the body. If left untreated, tuberculosis can be fatal. Causes and transmission. Tuberculosis is caused by the etiological agent Mycobacterium tuberculosis. M. tuberculosis is an acid-fast bacteria which can form acid-stable complexes when certain aromethane dyes are added. This bacteria is transmitted through the air from one person to another. Whenever one who is infected emits the bacteria by coughing, sneezing, or another method, people nearby may breathe it in and become infected. Since everyone infected with TB does not become sick, tuberculosis is classified into two types: latent TB infection and TB disease. When TB bacteria live in the body without causing the disease, it is called latent TB infection. When one has latent tuberculosis, they are not contagious and do not express any symptoms. However, it is possible for the bacteria to become active in the body and become TB disease. TB disease is the active form of tuberculosis in which the body cannot stop the bacteria from growing. Symptoms. Symptoms of TB disease depend on where in the body the TB bacteria are growing. TB disease in the lungs may cause symptoms such as a bad cough that lasts 3 weeks or longer, pain in the chest, and coughing up blood or sputum, which is a mixture of saliva and mucus. Other symptoms of TB disease are weakness or fatigue, weight loss, no appetite, chills, fever, and night sweats. Risk factors. Those who are most at risk for getting the disease are those in close contact with infected individuals, those with medical conditions that make the body less able to protect itself, such as diabetes, those from countries with high TB rates, those who work in or are residents of long-term care facilities, such as nursing homes, prisons, and some hospitals, those who are malnourished, those who are alcoholics or IV drug users, and finally, those who have HIV. HIV and TB. These two diseases often mask one another. Worldwide, TB is one of the leading causes of death among people living with HIV. Unfortunately, some people with HIV do not know that they are infected with TB. Similarly, 1 in 5 people with TB disease are unaware of their HIV status. Mechanisms of virulence and action. It has often been noted that there are no classical bacterial virulence factors for M. tuberculosis. That is, no toxin has been identified and there is no pathogenicity island in the genome. While there are many supposed virulence factors, knowledge is still limited. The genes encoding virulence factors in tuberculosis belong to different functional classes. First, secreted factors, which are products that are exported outside the bacteria. They include culture filtrate protein, such as HSPX, ESAT6, CFP10, 19KD, and more recently, kinase G. These proteins have been studied thoroughly due to their potential for vaccine and diagnostic applications. Second, cell surface components, which include proteins involved in synthesis of the cell wall, such as the LAM, which has multiple functions. It is an immunomodulator, which is an agent that diminishes immune responses and inhibits the release of calcium. Third, enzymes involved in metabolism. Some of these enzymes are involved in lipid and fatty acid metabolism, which allows bacteria to grow on fatty acids. Lastly, transcriptional regulators, the final category of virulence factors, is important in a promising vaccine candidate. Treatment. Tuberculosis can be diagnosed by the Mantoux tuberculin skin test performed by injecting a small amount of tuberculin, a complex of purified M. tuberculosis proteins, into the skin of the arm. The reaction formed on the arm determines the result of the test. A positive reaction for TB infection only reports that a person has been infected with TB bacteria. It does not tell whether or not the person has the active disease. Other tests used are a chest X-ray and examinations of sputum. Treatment requires the use of multiple drugs for several months, but with appropriate antibiotics, TB can be cured in most people. Treatment usually combines several different antibiotic drugs that are given for at least 6 months, and sometimes for as long as 12. Antibiotic drugs used to treat TB are the first-line drugs, isoniazid, rifampin, ethambutol, and pyrazinamide. The second-line drugs are aminoglycosides, polypeptides, fluoroquinolones, thioamides, cycloserine, and trazodone. Those who have latent TB infection should also be treated even though they carry less bacteria. This treatment is essential for controlling and eliminating TB. Prevention. To prevent TB from spreading in communities, patients must be isolated and there must be adequate ventilation. Also, identifying latent TB as quickly as possible is a form of prevention. In countries where tuberculosis is more common, infants are given the BCG vaccine. The Bacille-Calmette-Guerin vaccine can prevent severe tuberculosis in children. The BCG vaccine isn't recommended for general use in the United States because it isn't very effective in adults and it causes a false positive result on a TB skin test. Researchers are working on developing a more effective TB vaccine. New research and developments. More recently, 2 new types of tuberculosis have developed and increased dramatically over the last few years. Multi-drug resistant tuberculosis, commonly abbreviated MDR-TB, and extensively drug resistant TB, XDR-TB. Multi-drug resistant tuberculosis is a form of tuberculosis that is resistant to 2 or more of the primary drugs used for the treatment of tuberculosis. Extensively drug-resistant TB is TB resistant to at least isoniazid and rifampin among the first-line anti-TB drugs and is resistant to any fluoroquinolone and at least one of the 3 second-line injectable drugs. A patient who develops active diseases with a drug-resistant TB strain can transmit this form of TB to other individuals. Directly observed therapy should always be used in the treatment of drug-resistant TB. Also, new research as of March 12th has shown that the routine use of steroids to treat tuberculosis may help reduce deaths from all types of disease. Exactly how steroids help combat TB is not known, but they are believed to counter the tissue-damaging effects of the inflammatory response caused by the disease. It has been found that there were 17% less deaths overall among patients taking steroids than those who were not.